Hello everyone, I'm Damien Helene, Editor-in-Chief at Altaroc. Today I'm taking you to Boston to meet Daniel Baker. His name might not ring a bell, but he leads one of the most innovative healthcare companies in the United States. His company, HealthDrive, provides a comprehensive range of clinical services within long-term care facilities. Most of the patients they serve are elderly individuals who receive care under the Medicare program.
I've been here at HealthDrive actually today, ironically, is my 12-year anniversary here at HealthDrive. The prior 12 years to that, I spent working for a Fortune 100 publicly traded company, Omnicare. Subsequent to leaving Omnicare, they were acquired by CVS Aetna. During my time with Omnicare, came up and started in the sales and marketing side of the organization, moved into national account management, and then into operations. Most of my milestones, I would say, came on the operations side of the business, starting off as a more junior person at a singular operating location, and then very quickly moving myself up to having multi-site operational responsibility, and then concluding my time there with about $500 million in P&L responsibility. And then here at HealthDrive, really the two inflection milestones have been growth milestones, getting the organization shortly after I first joined into a growth mode that allow us to transact from our first private equity partners to our second, then navigating the pitfalls of the COVID-19 pandemic and coming out of that strong on the other side, and then selling the company again to our current partners at Cressy & Company in 2023. There's probably a couple along the way. During my time at Omnicare, when I first moved into the operations side of the business, the organization had recently acquired its largest national competitor. And in the market that I was operating in the Mid-Atlantic, the competitor that was acquired, that was their largest presence. And so I spent a good 18 to 24 months integrating a company that had recently been acquired, essentially its headquarter and its strongest operating sites, into the smaller sites from Omnicare, the acquiring company, which had a huge amount of cultural problems, people who weren't happy that they were being acquired, sites that operated very differently, different software platforms, different dispensing systems, and being able to have that undertaking, work with my team, develop a culture, and come out on the other side of it with a really strong operating group, a positive culture, and a portfolio that was growing. I'd say the second was the navigation of the COVID-19 pandemic. It was something that none of us had ever been through before. For us, because of the services that we were providing into our post-acute facilities, our revenue dropped by 90% during the first 60 days of the pandemic. It was the first time in the 7-8 years I had been here that we ever even had the thought that the doors might actually shut. We had to furlough 80-85% of the staff and the providers, but we still had patients that needed care. And it was the individual moral decisions on whether providers should be allowed to go into facilities and treat the patients, both for their own safety as well as for our geriatric patients and their safety. And then as the pandemic started to ease, trying to figure out from a business standpoint, how do we get folks back from furlough? How do we operate in a post-pandemic world? What's appropriate, what's not? Even down to how do I secure enough masks to be able to send out for our providers to be able to work? And so it created a whole new set of skills for myself and my team in learning how to navigate and operate in that environment. And we certainly learned a lot of lessons, and I think are better of it as an organization on the other side. Our mission is a fairly simple one. The patients that we serve are some of the most medically fragile, underserved patients in the entire U.S. healthcare ecosystem. And our mission is to touch as many of them as we can, do so in a compassionate way, in a consistent way. Too oftentimes these patients are left underserved, not getting the care that they needed because of who they are and where they are, and our mission is to change that narrative. The urgency of what the business faces today is really around the growing geriatric population that has a need for institutionalized care, and our ability to find providers, develop systems, and create efficiencies to be able to deliver the highest quality of care, to have the right clinician for the right patient available at the right time. The real differentiator for HealthDrive has always been the clinicians and the staff that support those clinicians, the culture that we've created. We have found some of the most dedicated individuals in the entire healthcare ecosystem who are willing to operate in a non-traditional environment, to have the appropriate compassion and respect and care for the patients in the nursing homes where we treat. And then we have layered that with industry differentiating technology, logistics, and operations that support those providers to make them more efficient, to help drive positive clinical outcomes while managing the overall total cost of care for these patients. The strongest feedback that we have gotten is an industry-leading retention rate. And really retention rate in two areas. One is in our customer base, so the long-term care post-acute facilities that we work with. We have an extremely high retention rate across all of our different service lines that are out there. And likely more importantly is we have our clinician retention rate is over 80% and has been for 8 years running now. To benchmark that against the healthcare industry here in the U.S., depending upon what sector you're in, but on average, you're looking more in the 40 to 45% clinician retention rate. HealthDrive's retention rate being almost double that is the strongest indicator we have of being in a best-in-class employer and having employees and clinicians who work for us who really value the work that they're doing. We have transacted and recapitalized the company twice during the 12 years that I've been here. Our last private equity partners had been with us for a five-year hold, and we had performed very well financially. And so we jointly made the decision with the management team and our financial sponsors that we wanted to take the company to market again, partner with a larger investor who could continue to support our strong growth. So we ran a very traditional formal process with an investment banker, solicited interest from a variety of financial sponsors and strategic operators. And had a significant amount of interest from the market and spoke with a number of potential interested investors. The Cressy team really stood apart from a number of the other folks that became finalists in our process, primarily for two reasons. One, Cressy's healthcare-only focus is very unique in the institutional market. And partnering with somebody who really has an understanding of healthcare was important. Even more important with the Cressy team was their expertise in servicing the dual eligible population. Almost everyone that we take care of here at HealthDrive is a Medicare, Medicaid, or dual eligible recipient. And that world is very different than some of the other healthcare verticals that exist out there. Their expertise there really stood out. And then finally was the alignment on vision, goal, and culture, both on our end and their end. And they really clearly respected the work and the culture that we had done here, and they put their best foot forward very quickly and expressed a strong interest, and we felt very comfortable that they were the right partner for us. The funding that we received from Cressy really will help support our M&A strategy. It's a key function of our longer-term growth. We have acquired over 30 organizations, other practices in the last 12 years that I've been here. The funding from them will allow us to continue to pursue some of the smaller opportunities that have been traditionally what we have done, but also look at larger organizations that, similar to HealthDrive, may be innovating in a specific area and allow us to expand both our service lines as well as the manner in which we deliver care. Further, in partnership with their expertise and what we do in-house here, the ability to have funding for program development, to move into new service lines, or to look at alternative technologies or ways to help make our clinicians more effective or more efficient will really help drive the growth for HealthDrive moving forward. So partnering with the Cressy team has really helped maintain the culture that we have built here for HealthDrive over the 3+ decades that the company's been in existence. Cressy has helped me help expand the executive team that we've got here, bring in some really strong folks, and they really have focused on maintaining and enhancing the culture that we've got, not looking to make significant changes and allowing us to run and lead our organization and be there as support. So I certainly understand that there is a perception at times between managements of sponsor-backed organizations, some animosity or tension between sponsors and management teams. Nothing could be farther from the truth with the Cressy team. We have been with them for close to 2 years now. And I couldn't think of an example where there has been tension between the board, the investors, and the management team. In fact, the opposite. They've been great advisors to us, mentors in certain situations, and have been extremely supportive of the growth goals, the decisions that we've made, and it's just been a great partnership. I think over the next 5 years, we really have an opportunity to differentiate ourselves in 2 key areas. One is driving clinical outcomes in this patient population. Treating the elderly population, the medically fragile population, has often been driven by maintenance and not really looking to achieve positive clinical outcomes. The definition of positive clinical outcomes may be different in our population, but there is a real opportunity to take this healthcare sector that has been overlooked for decades and make true positive clinical changes for this population. Similarly, because of the multiple comorbidities that this patient population has and how medicine has been delivered to them, the cost of care for these patients is often the highest in the entire healthcare ecosystem. I think we also have the ability to, while maintaining our goal of improving clinical outcomes, also manage down the overall total cost of care. Establishing what is appropriate for these patients at what time, having the right conversations with families and loved ones, making appropriate decisions for these folks really will allow us to be positioned as not just an industry leader, but an industry innovator. We're in an inflection point with technology in healthcare. And when I think about how to advise somebody who's looking to really be innovative in this space, I think now is the time to really push the boundaries, to see what AI and machine learning and these large language models can help assist clinicians with diagnosing, decision-making, care planning, with the large caveat that technology should never be designed to replace clinical education, clinical training, and clinical experience. We should be looking at technology as ways to assist our providers, help make them more efficient, reduce administrative time and burden, particularly as it relates to payers and documentation, and not have technology be meant to replace clinicians and that experience and that education that's so incredibly valuable. But the tools that we have that are coming to market, that are at market and are coming to market, really present an opportunity to push the boundaries and look at different ways of delivering care.